It's my cystic fibrosis presentation by Joshua Pookie, 300-353343, NRSG265 Assessment Task 1. We will be covering the etiology of cystic fibrosis, followed by the pathophysiology, then the medication, then finally finishing off with nursing considerations. Cystic fibrosis is a chronic condition primarily affecting the function of the exocrine glands in the respiratory, reproductive, and gastrointestinal systems. These glands help to protect and are responsible for the secretion of mucus in the respiratory system, pancreatic, and gastric juices in the gastrointestinal system. Cystic fibrosis, transmembrane conductance regulator protein, or CFTR, cells are located within the exocrine glands. These CFTR cells help facilitate the movement of chlorine ions out of the cells. This is crucial for moving water, which aids in the production and thinning of the exocrine gland secretion. The main risk factor for cystic fibrosis is family history, and this is due to the mutation of the CFTR gene, which determines the construction of the CFTR protein. This mutation is inherited through a process called autosomal recession, which is when the individual has inherited 2 copies of the dysfunctional gene from both parents. Cystic fibrosis has also been found to be more common in people of European descent. The mutation of the CFTR protein prevents it from being inserted into the cell membrane, and with the dysfunction of this protein, the exocrine cells lack the function of the chlorine pump. Stopping chlorine ions from being pumped out of the cell means that the water will not follow and will be held within these cells. This lack of water affects the production and thinning of the exocrine gland secretions. In the case of the respiratory system, this leaves a thick layer of mucus in the bronchial tract and prevents the cilia's ability to clear pathogens and microbes, leading to bronchitis and pneumonia. In the gastrointestinal tract, these thick secretions can clog the pancreatic ducts, preventing digestive enzymes secreted by the pancreas from being absorbed into the small intestine. After a time, if these digestive enzymes remain backed up, they can cause damage to the cells lining the pancreatic ducts, leading to complications such as pancreatitis and diabetes. Without enough digestive enzymes in the small intestines, there is poor nutrition absorption, leading to malnutrition and possible bowel obstruction. Additionally, bile ducts can be blocked by thick secretions, leading to the buildup of bile, damaging the biliary tract, leading to further damage of the liver and gallbladder. Thick secretions caused by the dysfunction of the exocrine glands also affect the reproduction for both males and females. In the case of females, this causes thickened cervical secretions, increasing the difficulty in the sperm's ability to pass through the cervix, lowering the rates in which women will get pregnant. While in males, this presents as thickened seminal fluid, decreasing the efficiency of transport. Now that we have an idea of what causes cystic fibrosis and how it affects the body, we'll now discuss treatment. Salbutamol is a short-acting beta-2 adrenergic agonist, or SABA, and is a common bronchodilator used in the management of cystic fibrosis. It is indicated for the relief of acute symptoms such as wheezing, shortness of breath, coughing, and asthma. Also, chronic obstructive pulmonary disease. In the case of cystic fibrosis, It plays a crucial role in alleviating symptoms and improving respiratory function. Related to Jacob's case, salbutamol can help relieve his acute symptoms of dyspnea and chronic coughing. Salbutamol works by binding to and activating beta-2 adrenergic receptor, which is primarily located within the bronchial smooth muscle cells. This activation stimulates an enzyme called adenylate cyclase. This initiates CAMP, causing phosphorylation in the myosin light chain kinase, stopping its activity, allowing for the myosin phosphate to turn into myosin, which allows for the relaxation of the bronchial smooth muscle. This dilation of airways allows for the ease of passage of air and provides relief from bronchospasms. Nursing considerations for salbutamol. Ensuring Jacob is using the inhaler in a correct manner and organizing a spacer if it is required. This also helps to improve the delivery of the drug. Providing thorough education to Jacob and his family about the importance of using his inhaler. Also, educating the family on what side effects to expect, such as headaches, palpitations, tremors, and as well as how to recognize the signs and symptoms of worsening respiratory distress. This concludes my presentation on cystic fibrosis.